A very good evening to you. Welcome to The Bottom Line, a wrap of the business news of the day. And we start, as we often do, with the number of the day, which of course is linked to us all digesting what was announced by the president last night. One commentator has called it a fiscal bazooka due to the enormity of the rescue package. Now, the number of the day of 500 billion rand or R500 billion, which of course is that economic package announced by the president last night in light of the COVID-19 crisis. So let's remind you where the money goes. Firstly, for a period of 6 months, those receiving social grants will receive more. A special unemployment grant has been implemented. 200 billion is for a lending program that will help small and medium-sized businesses to access cash. Then there's 20 billion for the health system and the same for municipalities. Where the money comes from is a little more difficult because South Africa is already deep in debt. The president said that 130 billion had already been allocated in the February budget, and that will now be reprioritized. And of course, South Africa has applied for a loan from the Unemployment Insurance Fund, the IMF, and it's approaching other lending organizations as well. Now, let's put South Africa's spending into context with the rest of the world. And we're bringing up another graph. We're now on a par roughly with the United States that has approved a $2 trillion stimulus package to help save small businesses. By spending as much as 10%, you can see there, of our GDP or the entire output of the economy, we are spending more than many countries in those lower brackets there in relative terms. Many commentators locally and globally have welcomed the package, although there are questions about its implementation. Well, let's talk about some of those questions. We're now joined on the line by the economic advisor to the president, Trudi Makhaya, who's also an economist. Trudi, thank you for being with us. If you're an advisor, it doesn't mean your advice will always be heeded. To what extent was the economic stimulus package announced last night what you think is good for South Africa?
Thank you, Francis, and good evening to your viewers. You're right. I mean, advise, you try the best that you can. But I think, the president has also been very open to ideas. So he spoke to various formations. He spoke to NEDLAC, which includes labor and civil society. He spoke to the broader Presidential Economic Advisory Council. He spoke to organized business. So there were lots of good ideas that were presented. And I think across the board, most people feel that they've been heard. There was generally consensus that what we need to do is to ensure that there isn't a humanitarian catastrophe that arises from the fallout from COVID, and to also find ways to keep the economy going in terms of giving support to ensure that the cash flow hit the demand and supply shocks that businesses are facing are not going to be shouldered by those businesses on their own that they support. So I think, this is one of those instances where there wasn't much disagreement in terms of what needs to be done. It was just a matter of, getting it together into one coherent program and thinking through how it would work, how it would be financed. And so I think most economists have welcomed or are supportive of what has been proposed.
I agree with you. There is a lot of support. What you've suggested, this is fire to fight a fire, but some concerns about implementation. For example, the UIF process, we know it's been slow in paying out people. I spoke to the Restaurant Association saying waiters are still waiting, starving in the meantime. Could it all come undone on the implementation? Are you worried about that?
So we've had lots of feedback, which I think has been taken in and been acted upon. I mean, you can think of any organization in the state. UIF, it's designed to deal with a particular problem that doesn't, where it's not a crisis, it's not a deluge of claims. So most systems will come under pressure, which is why it's been important that government has been very open to talk to other agencies within the state where the particular mandated agency is not able to cope, to try and help out, and would also talk broadly to other institutions in the economy. So, for instance, the banking sector, there's been constant conversation to think about how some of these disbursements will be done easily and more efficiently through other mechanisms and through other systems. So I think the implementation risk people are very well aware of because, this is a once-in-a-lifetime kind of experience. There's no institution that is built or designed for this, so we have to draw capacity where we can find it.
Yeah. And it'll be very interesting how the 350 Rand, this new grant for all unemployed people, will be distributed. Again, there could be a flood there, millions of people, many who don't even have the funds maybe to go somewhere to apply for this. Will it help, and will it help quickly enough?
So there's been an ongoing conversation with the churches, with civil society, with NGOs, to also assist in identifying people, assisting them to access the system where they might not have data or they might not have the means to reach people, and also for those organizations being on the ground to just give us that kind of feedback. So I think through NADLEG and structures like that, we're able to ensure that those implementation risks are minimized and that people who are outside the system, that grant was certainly designed particularly with people outside the current system in mind. So there's an awareness that these are people who are not necessarily on the radar, but who are in the informal economy and who are active and who've been negatively affected by COVID.
Yeah.
So I think the risks are very well understood, and there's lots of frantic work behind the scenes to bring everyone on board to ensure that the money gets to where it needs to reach.
Yeah. A concern that's been raised by some of the commentators is, this is meant to be temporary relief for 6 months, but won't it have to become permanent? It's very hard to give people something and then try and take it away.
It is very difficult. I think that's why it's being explained very carefully, that this is designed to deal with the effect of one particularly devastating event. You couldn't. There wasn't an option to do nothing. Because of fears around being able to reverse it. And also, taking into account that when life normalizes, when children go back to school and they have access to their feeding schemes, when people are able to sustain their micro-enterprises, it will be difficult, it will be gradual, but I think there would also be, an ethical understanding that other support measures are now back into gear and they no longer need this additional support.
Yeah.
And yes, I think it's very important to be clear that this is to deal with a very specific challenge, and that the state and the country doesn't have the resources to carry this for a long time. Even if people wanted to do this, there just wouldn't be the capacity. But in a crisis situation, it absolutely has to be done.
Yeah. So to do this, Trudi, South Africa is taking on more debt. It's going to the IMF. Some people dread that institution, although it sounds like it won't have any say over how we run our finances at the moment. Tell us how both these things are responsible in light of the crisis we face right now.
So I think I missed some of the last part of the question. I've always been the one to say we understand. I certainly understand why people, feel a certain way about these institutions. They've had a difficult history, but they've overcome that history in terms of the kind of policy advice they give to countries. For instance, the IMF recently talked about the need for countries to protect their emerging industries, the need for industrial policy. So they have moved. But more importantly, in this instance, that money is clearly earmarked as emergency money. It is concessional, coming at very low interest rates, and it also doesn't come with any significant conditionality other than just basic auditing of funds and to ensure that they're spent properly. But it's not attached to an economic policy program that often, that's what people would be anxious about, that we're going to be told what to do. But there is no scope for that at all in these packages.
All right. Trudi, I was also asking about the debt situation. Why is it responsible? What would you say to people who are concerned about that in light of the debt that we already have?
So, I mean, I think it's important to say that additional resourcing that's being sought will come very cheaply, as cheaply as we possibly can find it, so that it won't, it would be managed. But of course, the debt will increase. And so this is where the phase 3 of the economic reform comes into play, to say one of the ways that you would pay this debt is through economic growth. If the economy is roaring, if it gets back into gear, then you're able to generate the resources and the debt to GDP ratio is taken care of. The president was very clear that, there are reforms that government had been talking about for a long time. Some of them have already started in any event, and now these would be accelerated to ensure that when we do have rising debt, we also have rising capacity to service that debt.
Finally, Trudi, this is a lot, a massive package. But in terms of the actual health spending, I understand it's about 20 billion or so. In terms of where our hospitals are, is that enough to get us ready for what's coming when we're dealing with COVID-19?
So the Minister of Finance will lay it all out very clearly in the revised budget, because remember, you have to compare some of the additional amounts to what had already been budgeted for in the February budget. So it's in addition to those resources, but I think there will also be more clarity about the 3-year path for the health department. What is clear is that they will get additional resources. All of the reprioritization will be directed towards health, towards social spending, towards some of the economic alleviation. But health is being prioritized. So I would say, the budget would give a better sense of the total quantum that's going to health, but this is additional to what had already been appropriated to that department.
All right, we appreciate your time this evening. Thank you very much. Trudi Makhaya, economic advisor to the president. So obviously one of those involved behind the scenes in what was announced last night, saying that everybody who spoke to the president, gave him ideas, at least felt heard. All right, we've spoken about